Dr. Juan Dumois is a pediatrician of infectious diseases at Johns Hopkins All Children's Hospital. He joins me now from St. Petersburg, Florida. Really great to have you with us. We know that 4 of the kids in New York tested positive for the coronavirus and 11 did not. What do we know about the relationship between this illness and COVID-19?
It seems like COVID-19 might be a possible trigger for this illness. This illness is an interesting condition where children seem to have evidence of inflammation all across the body. They have symptoms that include fever, redness of the eyes, a rash. They feel and look miserable. And it closely resembles a condition we call Kawasaki disease that we've known about for 50 years. And this may be a new trigger for that.
And Dr. Dumois, we largely hear that kids will be asymptomatic. That being said, I have seen some parents running around with their kids outside who clearly need to run around, but a lot of them not wearing masks. Does this change the risk factor for children in this pandemic?
I don't think so. I really think that it's not a significant change in risk because it's very few children that are going to get this. We think that many children have already been infected with the coronavirus, but we just don't know. We haven't done extensive testing of children with very mild symptoms. The only kids who get tested for COVID-19 are the ones who are sick enough to present to the hospital or be admitted to the hospital, and there aren't a lot of those. So it's more likely that a lot of kids are getting infected and very few, a very small percentage, might be developing this new relatively rare condition.
So what should parents be on the lookout for?
In general, for this kind of condition that can be very serious, parents would want to look out for their child having fever that lasts at least 4 or 5 days. They've got a rash. The whites of their eyes have turned red, and that's not a really common finding with a lot of other viral infections, for example. And the children are not happy running around and playing with their fever. They feel miserable. They just are clingy. They want to lie down. They're not eating as much. They're not as responsive as normal. Those kids probably need to be evaluated in a healthcare facility.
And Dr. Dumois, we should note that this isn't just something that we're seeing here in the United States. It's something that is happening in a number of other countries where we've seen cases like this in children. We really appreciate you coming on to add your expertise. Thanks for that.